If you have been researching biological treatment for your knee, you've probably heard of PRP, maybe SVF, maybe stem cells. But there is one treatment you may not have heard of yet because it is new, because the name was only coined in November 2025, and because the only place in the world where it is currently performed is right here at the Madras Joint Rejuvenation Centre in Chennai. It's called PRASAD, Platelet Rich Adipose Stromal Advanced Derivative. In this video, I'm going to take you through every single step of the PRASAD orthobiologic treatment. What it is, what it contains, how it is performed, who it is for, and why I believe it represents the most complete biological approach to knee arthritis currently available without surgery. I created this treatment. My orthobiologic journey began in 2010. The intraosseous concept that is central to PRASAD goes back to 2013. So when I explain this, I explain it with the precision of someone who has lived every step of it. I created this treatment. My orthobiologic journey began in 2010. I explain it with the precision of someone who has lived every step of it. I am Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Centre in Chennai. I am a fellow of the Royal College of Surgeons, UK trained with 4 decades in orthopedics. Earlier in my career, I performed knee replacements, bilateral, revision, high friction, gender specific, computer assisted, eye assist. I introduced the oxenium knee in India. I now practice exclusively joint preservation and biological treatment. I have been performing orthobiologic treatments since 2012. PRP, bone marrow, autologous chondrocyte implantation, biological shoulder resurfacing, and from October 2018, SVF combined with PRP, what we now call as PRS. In November 2025, I brought all of this together under one name, PRASAD. This video is the complete, definitive explanation of what PRASAD is, step by step. The name and the concept. Let's start with the name itself, because every letter tells you something precise about the treatment. PRASAD is spelled as PRASAD. The letters PR stand for platelet rich. We use LPPRP, leukocyte poor platelet rich plasma, at a therapeutic dose of 10 billion platelets per knee. A. Adipose tissue from fat. The cellular component is derived from your own fat tissue, harvested on the day of the treatment, not from a donor. S. Stromal. This refers to the SVF, stromal vascular fraction, an entire biological ecosystem extracted from that fat. A. Advanced. This is the intellectual heart of the name. To understand its importance, we must look at the precursor to this treatment, the PRS. The PRS protocol coined by Jerome Stevens. PRS was a massive step forward, but it was focused primarily on the joint space. PRASAD is different because of this second A. In logic, a concept like man is defined by its essential characteristic. For man, that essence is rationality. A man might have a thumb, an appendix, or the gift of speech. These are important, but they don't change his essence as a rational being. PRASAD follows the same logic. Its essence is biological joint rejuvenation. The word advanced here is what we call an open-ended concept. It includes every essential characteristic we know today, and it is accommodative of every superior characteristic we discover tomorrow. Today, being advanced implies 2 major leaps. the intraosseous injection of bone marrow. And the third component of PRASAD is subchondral injection of bone marrow. This is the subchondral area, cartilage layer, the layer of bone just below, beneath or above the cartilage here, and here. This is the subchondral area on the femur, and this is the subchondral area on the tibia, which I integrated in September 2025, and the use of A-Kavach, macroglobulins as a biological shield. Tomorrow, as science validates new advances, they will be integrated into this layer. But the nature of PRASAD will not change. It remains a living commitment to excellence. D. Derivative. Everything in PRASAD is derived from your own body. Your blood, your fat, your bone marrow, nothing foreign. PRASAD is not a static recipe. It is a living commitment to the total sum of biological evidence, today and into the future. The three layers of the knee. To understand why PRASAD is structured the way it is, you need to understand the anatomy of the arthritic knee. There are three distinct anatomical layers that are affected, and each one requires a different biological approach. Layer 1. The intra-articular environment, the joint space. In arthritis, this is a chemical fire of inflammation. What PRASAD delivers? LP, PRP at 10 billion platelets to clear that fire. Layer 2, the cartilage interface, the surface of the joint. What PRASAD delivers? SVF, the fat-derived cell ecosystem that adheres to the surface to support repair. Layer 3, the subchondral bone, the bone directly beneath the cartilage. Critically, subchondral pathology drives arthritis pain. What PRASAD delivers? BMAC, bone marrow aspirate concentrate, injected intraosseously directly into the bone lesions. Standard PRP treats layer 1 only, SVF adds layer 2, PRASAD treats all three simultaneously. Standard PRP treats one layer, PRASAD treats all three simultaneously in one sitting. How PRASAD evolved? 13 years. I want to be transparent about how this was developed. 2010, I began performing PRP injections. First for tennis elbow, then knees. I performed my first intraosseous injection into a hip. That taught me that when bone is the pathology, the treatment must reach the bone. 2014, I performed autologous chondrocyte implantation. 2018, my first SVF case. I have documented this on this channel. I added intraosseous PRP to the knee. September 2025, I upgraded the subchondral layer to BMAC. November 2025, I gave this fully evolved treatment its name, PRASAD. Each step documented, each refinement driven by patient outcomes. 13 years. This is not a new idea dressed in new language. It is a documented evolution. Metabolic preparation. PRASAD is not just a procedure. It is a prepared patient receiving a precise treatment. If a body is metabolically compromised, high sugar, vitamin D deficiency, anemia, even the most sophisticated treatment will underperform. We check HbA1c, vitamin D, inflammatory markers. Only when the environment is favorable do we treat the joint. PRASAD is not just a procedure. It is a prepared patient receiving a precise treatment. The treatment day. Step 1. Assessment. We review your metabolic workup and confirm candidacy. Step 2. Blood harvest. We process 10 billion platelets for your LP-PRP. Step 3. Fat harvest, a comfortable mini liposuction to isolate your SVF. Step 4, bone marrow harvest, a targeted aspiration for your bone marrow aspirate concentrate. Step 5, subchondral injection. Under real-time imaging, we place BMAC directly into the bone lesions. Step 6, intra-articular injections. We deliver the LP, PRP and SVF into the joint space under ultrasound guidance. Step 7, recovery. You walk out of the clinic the same day, no crutches. 4 to 5 hours, your blood, your fat, your bone marrow, your own knee, still yours. What to expect? In the first week, some soreness is normal. It is the biological fire starting the repair. Months 1 to 3, the biology is working, but structural changes take time. Months 3 to 6, this is when we see significant pain reduction and functional return. We do not promise miracles, but we have followed patients for over 8 years with sustained benefits that have changed their lives. Candidacy. For whom is it worthwhile? PRASAD is best for grade 2 and grade 3 arthritis patients. For grade 4, bone on bone, we follow the ESCA Orbit 2025 consensus. Cell-based therapy is now a recognized option for those avoiding surgery. Age alone does not disqualify you. The grade and the metabolic profile do. Overseas patients. If you are coming from the UK, US or Africa, allow 1 to 2 weeks in Chennai. The cost of PRASAD is a fraction of a replacement surgery abroad, and you leave with your own joint intact. PRASAD is the most complete biological approach I know of. 3 layers, 3 agents, 1 sitting, 13 years in the making. For the right patient, it is the difference between a knee replacement and a knee worth keeping. If you want to know if you are a candidate, the link is in the description. Subscribe and tell me which of the 3 layers surprised you most.